All right. So it looks like we are live. I'm just going to confirm on YouTube and Facebook. Yep. All right. So welcome everyone to the first BGA Insurance Ask Us Anything Medicare discussion. Today we have Joe and Greg, who are the co-founders of BGA. So we'll wait a second to see if anybody pops in, but if you guys have any questions you'd like to ask, just drop them in either the comment section of YouTube or Facebook, and we'll be happy to answer them for you. Feel free to do that at any point during this video, and we'll pull it up on screen and let you, get some free advice if we can. First thing I figure we'll talk about, Joe, is any news in the Medicare world. I know you wrote a recent blog post on, some changes with insulin. So is there anything people should know about, insulin changes?
Yeah, Ryan. For years, Greg and I have been in the insurance business, and every year during annual enrollment, we're constantly reviewing drug plans for our clients, and we review hundreds, if not thousands, of years between us and thousands of plans, between us and our agents. And one of the biggest costs that are out there is anybody who is on insulin, and anybody who is on insulin knows that takes up most of their costs, getting into the donut hole and things like that with Part D. And right now, President Trump is working on a plan to reduce the cost to cap it at $35, for no matter how many units you're taking per month. That's what it looks like right now. It's still in the preliminary talks. They're hoping to have this for 2021. So come October, when we start reviewing drug plans for our clients, we're hoping to have those costs for them, which would bring the cost down significantly what they spend each year on prescription medicine, and mainly, insulin, the cost of insulin. So anybody who is type 1 diabetic is really suffering out of their pocketbook when it comes to spending money on insulin on a monthly basis. So that's a pretty big. That was like the biggest news that I saw over the last month with Medicare, because that just affects millions of seniors every year. I know my own dad was on insulin, and between insulin and some of the heart medications, he was up around $7,000 a year, and the cost of insulin was a big portion of that.
Right.
That's gonna be a welcome relief for a lot of seniors this coming year. Hopefully, if this bill gets through.
Now, is this a situation where you have to wait until annual enrollment period, or can you, contact you guys or somebody ahead of time to get this process rolling? Is there anything people have to do, or does it just become effective in 2021?
They're talking about it being effective in 2021. So if that happens, we will have rates. What happens is the Part D drug plans, they come out with the new rates and new costs and co-pays around the first week of October. So we always ask our clients to start emailing us a list of their prescriptions with the milligrams and dosages so we can start reviewing those plans. The annual enrollment period runs October 15th through December 7th. So we're able to sign them up for any plan that would fit them best during that time, which would take in effect 2021 January 1st. So the bill hasn't passed yet, as far as we know, but they're looking that it looks pretty good, and it looks like it's going to be for 2021 January 1st start date. So we should have those prices come the first weekend of October, if that's the case. If not, we will get word somewhere into 2021. But I'm hoping that it's going to be this coming fall that we get to see those prices.
In the meantime, to go with what you were saying, Joe, Ryan, you had asked about annual enrollment period. If someone had to wait until then, they do have to wait until then to make changes, but it's still worth reaching out ahead of time. There are some cost containment ideas we have. Like, a lot of people don't realize the doctor is typically going to prescribe you, a set of pens to give yourself insulin. But a great way to save money is to get a vial and do the injections without the pen. So you do your own draw as opposed to using a pen. I mean, that's a huge cost savings, and people don't realize that. Your doctor prescribes it, you take it, but that could really reduce a payment, especially if you're in that coverage gap. Which right now, anybody who's diabetic, we're getting to, if you've been taking insulin all year, you're probably in that coverage gap with the donut hole.
Right.
or you're probably really close. Like I said, it's worth reaching out. I mean, there are some cost containment measures that we can discuss. We can't make any changes unless you had a special enrollment that we'd have to kind of figure out for you. But until what Joe was just talking about, until these these big measures take place that Trump's trying to put in place right now, it's worth a conversation. It can't hurt to talk and see if we can help save you money in that way.
And just to clarify, Greg just brought up special enrollment, which is called SEP. To give you an example of that is I have a client right now moving to South Carolina, and he will fall into a special election, so he will be able to change his drug plan and not be in the annual enrollment period. So that'll happen next month, as long as you do it within 30 days of your move.
Right.
He'll fall into a special election where we can change his drug plan in that new area, and it's required basically.
Yeah. Okay.
He will be out of his network. So that's an example of what's called a special election.
Gotcha. Speaking of enrolling in Medicare, if somebody is 64 right now, do they have to wait until the annual enrollment period, or can they get that process rolling immediately? What's the procedure there? Whoever wants to take that.
Well, I mean, if you're 64 now, there's a couple things to keep in mind. If you are turning 65 in the next 6 months, it's probably time to start looking at what your options are. Just to run down the bases of what you have to look at is if you're getting ready to turn 65 and you're not collecting Social Security, then you need to decide what you're doing. So if you don't collect Social Security at 65, which most people today don't, because that's not their full Social Security payment, you're not going to get a Medicare card. They're not going to reach out to you. You have to take the baton and start running with it. So if you're turning 65 within the next 6 months, let's say you're covered at your workplace. You've got to find out from your workplace, hey, do I need to take Medicare? Do I not need to take Medicare? You have to decide if you're planning on retiring and if you're going to need health care at that time. So if you're someone who goes to a workplace and you have a large, if your employer is a large employer, you probably don't have to do anything with Medicare. But you don't know that until you ask those questions. That's what we're here for. If you're a smaller employer, there's a good chance you do have to take Part B of Medicare. It might even be required by law. And then the third thing is let's say you are not going to be working any longer, but you're also not taking Social Security. Now you have to actively go Social Security either via the internet or in person or by phone. That's probably the worst method because it takes so long. But you have to now sign up for Medicare. Now, if you're somebody who retired back when you were 62 and you took Social Security when you were first eligible, you're probably going to get a card, when you're in that 3 month area, 3 months before 65, you're going to automatically get a Medicare card, whether you want it or not. And then you'd have to make a decision, do I want to take Part B or don't I? And that's where we come in. And like I said, with all these questions, we're going to have answers for each situation to help work it out, or at least point you in the right direction if it's a matter of, hey, do I have to go talk to my workplace? Well, what should I be asking them? Well, we're going to give you what you should be asking so you know what answers you need to move forward.
Right.
And, and here's another point also is when you turn 65 and you're still employed and they're still offering you health benefits, I always say reach out to us also, because I find a lot of times that if you stay on the employer benefits, it's more money out of your pocket than it would be to get on Medicare in some instances. So, I mean, I had a client who was spending upwards around $800-900 a month for their insurance through their employer, and it was just covering her and her husband. And pretty much, getting them both on Medicare or Medicare Supplements drug plans was a fraction of that cost. So it's always good to reach out and find out find out exactly what you're paying with your employer, because it could be less expensive to get on Medicare at that point. So it's always good to talk about regardless once you reach the age of 65.
Right.
And I always tell people, look, if the employer benefits are costing you less money, they're better at that point. Stay on it. I'd love to get your business, but that's the right thing to do. But there are some instances where we can get that business and help those folks save a lot of money getting on Medicare at that point.
Yeah, and some people have this misconception that Medicare is bad. A lot of people think like, oh, I don't want that. That's not going to be great insurance. I have a PPO at work. It's always been the best. I don't care if it costs me $1,100 a month. I think that misconception, I think people need to educate themselves to not have that misconception, because Medicare, for all intents and purposes, most of the customers I have that have Medicare plans with us, they can't believe how good the coverage can be. And I know there's a lot of, people talk about the drug coverage and the donut holes, but if you have a supplement and you never have a copay and you never have a referral again in your life, I mean, you can't get better coverage than that. I wish I could get coverage like that. So I say to people who go, well, I love my PPO. I've had it for 20 years at my workplace, and I know it costs me a lot, but I don't think I want to switch. I don't think I want to get on Medicare. I think it's worth a conversation. I mean, it doesn't cost you anything to discuss your options, and it's always worth looking at that. So that's what I just like to make sure people know what their options are.
Yeah, no, that's good. I think that's pretty clear.
You know what I find also, the Philadelphia School District, the HOP program, it's also because I've noticed that a lot of their Advantage, their HMOs, they're exactly like the Keystone. They use the Keystone Advantage plans, and they actually charge more for it to stay on those plans. They give $100 kickback, but in those cases, you could save yourself hundreds of dollars for the same exact plan and get on yourself. So it's always worth talking about that. Also, they offer a lot of different programs, so it's not in every single case, but for a lot of those HMOs, it's definitely worth your time talking about to see how much money you could save getting on the same exact plan through Medicare.
Right. Okay. For somebody who's brand new and they are going to be getting onto Medicare, there's Medicare Part A, which would be original Medicare. Can you guys explain what that means if somebody is on original Medicare? And then you guys brought up a supplement a minute ago, how that might factor in.
So original Medicare is two parts. So there's four parts to Medicare. There's A, B, C, and D. A and B is actually original Medicare. So A and B together, you're considered having original Medicare. If you had a Medicare card, that would be on there. Medicare Part A, and then Part B if you elected it. Medicare Part A is your hospital coverage. It's your skilled nursing care. It is what you paid your FICA taxes to. You don't pay for Part A any longer once you have it, unless for some reason you didn't have enough quarters and you might need to pay it. But majority of Americans have worked their quarters and get it automatically. Part B is your medical portion. It's going to cover roughly 80% of your medical doctors, specialists, medical equipment, with some deductibles. That's original Medicare. Now, Part C is Medicare Advantage. That's private insurance. So by private insurance, I mean Medicare Advantage is going to take over for original Medicare, kind of put that on the side and be your primary coverage. Medicare Part D is prescription drug coverage, D for drug, try to make it something a little bit easier for us. So you can have A, B, you can have C or D. You can't have both. If you choose C, it's probably going to give you drug coverage. If you choose D, then you may want to add a Medicare supplement separately. And a supplement is going to fill the gaps of original Medicare. Because with original Medicare, there's no max out of pocket. Your 20% of all costs can go infinitely high. Whereas if you have a supplement in place, you're going to cut those costs down to little or almost nothing. And in the case of a supplement, Medicare stays your primary, supplement becomes the secondary, and then you have separate prescription coverage. In the case of Medicare Advantage, which again is called Part C, that is going to take over for Medicare, and it's going to wrap everything into one plan. So it's going to put your A, your B, and your D together, and it's going to give you Part C. But C and D is not considered original Medicare because it's run by private insurance companies. It's completely separate. So that's like the short, 30-second snippet to give people an idea of what they're getting. But we can always go a little further into that if you want to delve into it.
Yeah. Joe, you want to add anything you want to add to that?
Well, just to let you know that at BGA, we are also helping folks with Medicare Supplements, which is also called Medicare, and Part C plans. We're not just Medicare and Medicare Supplement plans. We help people out with the Medicare Supplements, also any Part C plan through various carriers like Independence Blue Cross and Aetna, et cetera. And then also drug plans Part D. So, we're not just, we just don't do Medicare Supplement plans. We're well-rounded in the Medicare world with all of our clients. So we have clients in different areas who take advantage of certain Part C plans, and some areas are very big on Medicare Supplement plans. It also comes down to income and things like that. So, when we sit down with you, we're kind of getting a feel for what you're looking for in a health plan, what your monthly budget is, and healthy, and all those kind of variables that are involved to kind of pinpoint what the best plan is for our clients. So we're not just basically pigeonholing our client one single plan.
Right.
So we carry both Medigap Part C plans with various carriers. We're basically with 30 carriers regarding Part C plans and Medicare supplements.
Okay. And then are there options depending on where you live? Does your zip code matter? Does your location matter on the various plans that are available?
It does with Medicare Advantage plans, HMOs. The 5 county areas, Independence, Blue Cross, and then you got Highmark and the other zip codes that throughout Pennsylvania, same thing in Jersey. So it is regionalized. It's something that if you're living in Bucks County, you want to make sure your doctor accepts those plans also, because HMOs, you want to make sure your doctor's in the network. With Medicare, your red, white, and blue Medicare card with the supplement, I mean, you're not restricted in any area. You're nationwide as long as a doctor, hospital, or specialist accepts Medicare. They have to accept your Medicare supplement plan. So with Medicare, you basically have an open network, where with an HMO, it's more regionalized in certain zip codes. With the PPO, you have more access throughout more Medicare doctors throughout the country. But it is with Part C plans, it's a certain areas that you're looking at to make sure your doctor accepts it and you live in that area.
Right. So speaking of doctors, well, actually, Greg, I don't know if you had anything else to add to that, but I was going to bring up the idea of telehealth, which is something that's really big right now because obviously a lot of people are locked up at home. A lot of seniors are locked up at home. So is there anything regarding telehealth that people need to know when it comes to Medicare? Are there any updates on that, how it works with doctors? Do people need to, have anything approved ahead of time? Or how does telehealth factor into this? That's just up in the air for anyone.
I mean, with the Medicare, with original Medicare and a supplement, telehealth's going to come in at no cost. I mean, you're going to have no copay on that. There's no pre-approval or anything. It's mostly with your primary, sometimes a specialist, it depends. Obviously, with the whole COVID pandemic, it's caused a lot more need for telehealth. But I think it started off something new. I don't think it's going to go all back to in-person visits all the time. I think telehealth is kind of a wave of the future for all age groups, not just Medicare age group, but I think it's very helpful. And like I said, Medicare supplements kind of cover the whole cost, whereas Medicare Advantage now, if it's due to the pandemic, there's been no cost for this, but I don't know what will change. So as we go into the new enrollment period, we're going to be finding out information soon, what new plans are going to look like. I'd venture a guess that telehealth's going to go down to either a zero or minimal copay for pretty much all plans. And again, for now, it's been no copay because of the COVID situation. So we're looking to see when that new information is going to flow through to us to find out. I mean, my own health insurance, it used to be a pretty good sized copay for a telehealth visit. And I found it kind of silly because I'm like, well, if I'm getting telehealth and it's costing me as much as going into my doctor, I'm not going to pay. I'd rather just go see my doctor.
Right.
With the pandemic issue, they knocked that down to nothing. So now I can do a telehealth visit and pay zero for it. That's going on with Medicare as well. I think the guidance in the future, though, I mean, there's a good chance that the telehealth visits are just going to become more common, and therefore, like I said, knock that cost way down.
Yeah, something I'll add to that. I wrote a blog on that a couple of months ago when the whole pandemic went down. And they really loosened up a lot of restrictions regarding telehealth. Like Greg said, the copays on a Medicare Advantage plan, they knocked that off. But the other thing is also, before it was required, if you to be able to use telehealth service, you had to see your doctor or something like that within 2 years to be able to make a phone call or a video call. And they kind of loosened the restrictions on that. So if you have not seen your doctor in 2 years, you're still able to make that telehealth call to get in touch with your doctor if you are concerned with any health issues. So I always recommend to tell my clients to kind of use that system, being that they've been locked up and they've been home. And if you haven't seen your doctor in 2 years, don't worry about it. They're not going to hold that against you. You could still make that call, and it'll be a legit telehealth call. But yeah, they were restricting that before this whole thing went down with the COVID-19.
Gotcha. So speaking of blogs, you had wrote a blog, I think back in early May about, backups with Social Security, or like, I guess if you were planning on getting on Medicare, there were, due to the delays and the shutdowns in the offices, Social Security offices, you were recommending people kind of start the process early. Is that still the case?
Yeah, I mean, I've always recommended to start the process a lot earlier. without knocking Social Security, but you're dealing with people who, I don't know, they may be getting paid $10 an hour. They don't have all the information at hand. Sometimes they're just administrators, and sometimes they get wrong information. Okay, just like any other company. But during this COVID-19, now I've had some people try to get on last minute, and before COVID-19 went down, they were able to get their affairs in order to get on Medicare Part B for the first of the month, whether they were a couple days late or not, to sign up for a supplement. But now it seems like they've been running a skeleton crew at Social Security when COVID-19 went down. It's getting better. But I mean, when nobody was answering the phones, they were told to send applications to somewhere up in New York. There was a lot of misinformation out there. And even people who were trying to get on earlier were not getting their Medicare cards in time, or they weren't able to speak to anybody or get anybody to review their paperwork to get on the Medicare Part B, because that's what you need to do to sign up for Medicare Part B. Right. So I was basically just telling my clients, get this done. The minute that you know that you're retiring, or the month that you're getting on Medicare, get it done right away. It's imperative that you do it early because it's not something you want to wait on. Because by the time you get your Medicare card, it could be a month late before you're able to get a Medicare or Medicare Advantage plan at that point. So you want to get it done right away. We always recommend normally just to do it 3 months before. 3 months before you turn age 65 or before you're retiring. So if you do it even early in that, that's what I would suggest. Because it did get slow. It seems to be loosening up. It seems to be getting a little bit better now, though. Things seem to be moving a little better.
So are there any consequences to signing up late? I mean, is it a situation where you're just going to be waiting longer and longer, to actually get the coverage, and you might have a gap or something like that?
Well, yeah, I mean, you don't want to wait, because what happens is let's say your 65th birthday is in July 7th. Well, July 1st, you're eligible for Medicare, and you're looking at a Medicare Advantage plan. Well,
we got a visitor.
Hey, how you doing, Bryce?
Hello, guy.
Celebrate.
So, I mean, if it becomes you're in the middle of July and you want to get on a Medicare Advantage plan, well, that plan is not going to take effect until the first day of the month of the following month. Right. You're without health coverage. After 30 days. That could be a problem. They hate us on Medicare now.
So this is what happens when there's a pandemic and you have to work from home.
Yeah.
Who's that big dog of yours?
You get the intruders.
He's on a live YouTube stream. He was celebrating. He's potty training, so that has.
It's a big day. It's a big month. Actually. It's a big month-long process, or longer.
I'm glad we got that on TV for everybody.
Oh, that's great.
Well, there's a lot of viral YouTube videos. I don't know if you saw some where people were getting interviewed like live on like CBS or something, and then like the kid barges in and the guy's like trying to push his head out of the picture, and it's like, and then the other girl comes in on like a scooter and follows him up. It's like,
does Bryce have any questions, by the way?
What's that?
Bryce, we could use a couple questions.
Well, all his questions would have to do with is what kind of snack he's going to get for doing his potty business. So I don't know if it's going to help us. But so getting back to Medicare, talk a little about COVID, though. There is one thing I want to mention, and I just came upon this today, actually. If somebody had an enrollment period that was affected by the pandemic, we do still have time to use that enrollment period, even if it expired. So I had a young lady who was on Medicare disability. She went back to work. She lost her job during the pandemic, giving her an enrollment period. However, unbeknownst to her, in losing her job, she lost her coverage as well. We were able to use that enrollment period still and mark off that she was, it was due to COVID that she was had the enrollment period. So if somebody is being affected by this, if somebody thinks, hey, maybe I can make a change because I lost coverage at some point, whenever, I don't know if I have an enrollment period or not. Again, that's just something we could discuss. And there's a timeline we have to follow, but we can look back, and if your enrollment period was during a time where your state was in a state of emergency, we should still be able to use that enrollment period for you. So it's not common, but it can happen.
So you think there's a chance they could actually delay annual enrollment for any reason if the pandemic kind of like sprung back up in the fall?
And it's possible. I mean, they think about what they dealt with at the Social Security office.
Yeah.
It's quite possible because a lot of people did not get their coverage in time, especially if they won, like I mentioned before, when they won the Medicare Advantage plan. That plan won't take effect until the first day of the following month.
Right.
The coverage, it's a pretty good deal for someone age 65 and over.
I think what's really important is being prepared for it. As in, I think, a lot of seniors are used to the way we like to do business, which is come out to your home, sit down, meet with you, go over the ins and outs. And it just doesn't look like that's going to be possible this year. Even if everything goes as planned, there's still a good chance we'll probably get some guidance from companies saying, hey, we don't necessarily want you going and sitting in everybody's homes. But when I say be prepared, it's we as a company are making sure we're on top of it, that we can do things like this. We can be on TV or live stream, or we can do Zoom meetings with clients, anything we can do to make their lives a little easier. Because I got to be honest, maybe they'll delay AEP, but I doubt it. I think the government likes to keep that in line. They could extend it if anything, but I don't think they'll delay it. But it's more for us to be on top of our game and make sure that we can get the information to our clients and get it to prospective clients, make sure their questions are answered, make sure that if they need some real live information, they can be one-on-one with us. They could be a group setting with us. I mean, I've done Zoom meetings with clients, and we're not suit and tie while we're doing them anymore. And sometimes people catch me with kids running in the room, but we have, like I said, we're getting better at what we do because of this, because we have to be able to, the information's got to get to our clients somehow. So we're getting it to them every way possible. Phone calls, conference calls, emails, Zoom calls, whatever it takes. We're trying to get in touch with our clients for this.
Yeah, I mean, we have a pretty good way of explaining it over the telephone, make it real easy. We've been doing this for a lot of years. So we're pretty well versed explaining Medicare, explaining how the supplements work, the Medicare Advantage plans work, the Part D. And, it's helpful for clients because our business, basically is old-fashioned, right in front of you, right at your kitchen table with you. And we haven't been able to do that during this time period. Yeah. So, we had to adjust, and, we've had no issues since. So it's worked out pretty well. Normally, I'd like to meet somebody for the first time, at least for the first time, and then we can talk by the phone. But, there's a lot of, a couple trials and error in the very beginning, but it worked out in the end, and people are getting the help that they need.
All right. I think we can probably start wrapping it up here. What I think we should do is we might have some more of these kind of like Ask Me Anything style videos, like you guys said. I mean, since it's going to be harder to sit in person with people, maybe what we can do is we can bring up some plans on screen, and in the future we can show people any changes that were made or anything you guys want to share. So that people can kind of get the information without actually having to sit down with each of you guys or try to schedule an in-person appointment. Is there anything else you guys wanted to add before we kind of wrap it up for today?
Well, I think next on the calendar, if anyone's listening, is we said we will be talking about Medicare Advantage plans primarily next week, or next time we have our discussion. So, anybody who's interested in learning about how Part C, the ins and outs of Part C, that's what we'll be explaining next time around.
Cool. All right. Anything in closing, Greg?
No, just everybody stay safe out there. Join us next week. And like Joe said, we'll go over some Medicare Advantage, and we're just going to try and keep this up week after week, making sure we're covering the topics necessary. I know it's not the most exciting stuff in the world, and we're not going to have a ton of comic relief, but it's necessary. I mean, it's like, you don't like to do your taxes, but that's life. You got to do it. You don't want to deal with Medicare, but it's just part of life, especially once you get 65. So we're here.
All right. So we'll wrap it up for this week, and we'll be back with another video. We'll talk Medicare Advantage and maybe some more news that's happening. So see you guys.
Good.
See you guys.